Welcome, everybody, to the first Medicaid Client Voice Council meeting. We are waiting on one more member, so hopefully Ketty will arrive and she could slip in and join the group. 2 members will not be joining us. One of them said they feel like they got hit by a truck and nobody got the tags, so she's under the weather. The other has a sick child. So they'll be watching on Zoom. They won't be able to participate, but they are really disappointed they couldn't be here, and I'm disappointed they couldn't be here too, because this is an exciting day. It's an exciting day for me. When I was thinking of leaving television journalism after a 27-plus year career, I had a meeting with Cindy Gillespie, who will speak to you in a moment, the Secretary of DHS, and she told me at that very first meeting when we met that DHS hears from providers and we hear from lawmakers, but we need to hear more from clients. So she has had this on her radar for a long time, that this needed to happen, that we needed a way for our clients around the state to give us input on policies, on programs, on improvements, on changes. And so this is the first step towards that. And you guys are an integral part of the history of our organization, because we're really excited about the feedback we're going to get from you and that you'll be able to provide to improve the services that we offer the citizens of Arkansas and the Medicaid recipients in particular. So without further ado, let me introduce to you the Secretary of the Department of Human Services, Cindy Gillespie.
It's not necessary. Y'all are the ones I should be applauding today. I just want to thank you all for being here today and for, well, let me start. I said this to a number of you. We could have had a worse day for weather, but this was a pretty bad one, and a lot of you came a long way. And I just want to say thank you. That tells me that this means as much to you as it does to us. And I really want to just personally say thank you for that. This is, as Jason said, for us, really a momentous moment. We have always heard from our clients and need to hear more from our clients, but always heard from our clients in these ad hoc ways, right? Somebody has a problem, they call. Occasionally we hold a focus group. We do reach outs, we send out information, etc. To actually have a group of our clients who have agreed to work with us to improve our services and to make sure we're being responsive and providing what is needed is huge. It takes a lot of courage for you to do this. It's, the main thing I want to make sure you all understand, I mean, as Jason said, this is something I've wanted to do since I got here. Some other states do this. This is an incredibly valuable resource in those states as they are doing policy planning, as they are thinking through operations, to be able to have that real life engagement and involvement. But what I want to mostly encourage you to do is realize we actually want to know where we might be missing it. Okay? Don't be afraid to tell us. Having a discussion around something where you help us point out things that could potentially strengthen something, that is not a negative exchange. That's a positive exchange. One of the things we try so hard to do inside our agency is to realize that having honest discussions and pointing out where things could be better is actually a positive, productive exercise. It is not something to shirk away from. That doesn't mean that you're being negative or hostile. So I really do want to encourage you to be honest. In that same vein, when there's something our folks are doing well, please also be willing to tell us that. Because the other side of it is, we could focus, if we don't realize something good is happening, we could end up deciding it's not working and not do that. So don't be afraid to tell us when something actually is something that you're going, you know what, that helped a lot. That made things better. So we will continue doing it. But also give us that honest feedback. You're going to be representing not just yourself, but you're actually also representing all of the Medicaid clients. And so I also encourage you to help us think about, even if something doesn't really hit you, even if it's not something that impacts you, give us your thoughts as well. on behalf of others, because, if we sit in a room and try to think of it ourselves, we will miss things. We really need some real life experience. You're going to find over the months ahead, we view this as a permanent institution that is now a part of DHS. And so you will find over the months ahead that we make this a sounding board constantly for what we're doing and how we're going forward. When I first came to DHS years ago, I used to say to them all the time, well, when things slow down, never realizing things never slow down. So now what I say to all of you is the months ahead are going to be incredibly busy. There is a lot happening. There's a lot happening with new and exciting areas. The governor and the legislature just making the money available for us to be able to move the folks that are on the developmental disabilities, the CES waiver wait list off over the next 3 years, 2.5 to 3 years, is huge. That is awesome and wonderful. So now we really have to look at that process really well, right? To make sure it's going to work, because we've never had to move this many people that quickly. And providers in the state are really going to have more people they have to serve very rapidly. So we will be wanting input as we move our way through that. Probably the one that keeps me, and I know Dawn, up every single night is the public health emergency that we have all been through. Has been traumatic for all of us, right? And particularly for all of our clients. But as we wind it down, and all of the changes that have been in place around eligibility, around providers, around a number of areas, that is a massive exercise for this entire state. And we will be working with all of you on that, because that's incredibly important. There's so many pieces that we will be coming to you. So this will not be just a casual, hey, let us know what you think sort of council, right? This is actually a working council to work with us. And what you tell us will matter. What you tell us, we will listen to. So I just did want to make sure I kind of started it with that, so that you would understand why we're all so excited to be here. With that, I could ramble on forever because I am very excited about this, but I will stop because you did not come to hear me. But I am going to, as we evolve the council over the years to come, we started with Medicaid because this is for us our largest client base. It is also an area that is undergoing, as I said, a lot of change with the public health emergency ending and a lot of other programs, but it's also our largest. We have over 1.1 million Arkansans are in Medicaid. So when you think about that and realize there are 3 million Arkansans, a third of the state is in this program, and you're representing them. So it is a huge program. So we started with that. In the years to come, as the sort of beginning group, you get to help us figure out how this council works and what it does. But in the years to come, we hope to do what Colorado and other states have done and expand the council out to grow and include some other programs. SNAP, for example, is a large program for us. Childcare. There'll be other programs that we add on, councils, so we can hear from the clients in those areas. But Medicaid is where we're starting, and Medicaid is where we have the largest impact in the state with the programs. So I urge you to please make sure, even in between council meetings, you are reaching out to Jason and others. When you see issues, bring them to our attention. Don't feel like you need to just wait till the next council meeting, okay? When you have things that you want to make sure we all talk about, tell Jason. So use this as what it is. It's your council. it's our council together. It's a way for us to hear the voice of the Medicaid clients. So with that, I finally really will stop talking this time. Okay. And I'm going to turn it over to Dawn Staley. Dawn is the state's Medicaid director, and she's also the deputy director at DHS.
Thank you, Secretary Gillespie. First, I just want to say we are here to serve you. And I think that's very important because it's so much of what we do every day in terms of thinking about the policies, the programs, the work that we do. We are here to serve you. And so I am deeply honored that you have chosen to spend your time and experiences with us here in helping us better shape the way that we implement Medicaid today, tomorrow, and in the future. Each of you have so much that you bring into this, whether it's your experience in the Medicaid program or as parents, as caregivers, as March Madness fans. All of that makes you all unique and so wonderful to be with us here today and to help us as we kick off this inaugural Medicaid Client Voice Council meeting. With that, I just want to take a little bit and talk about the council in terms of who we have here and who all is represented. You all are a unique group in many ways. One of those is that y'all were chosen from a group of 60 applicants who applied to be on the group. It was amazing that we had 60 people across the state who said they are interested in being a part of this, interested in helping us learn more about what the program is like, their experiences, and how we can do better. And so as part of that, we have representation from all 6 DHS regions. So we're thrilled that many of you came in from various parts of the state, especially within the weather, as Secretary Gillespie said, to be with us here today, as well as those of you who are joining us remotely. We really appreciate you being here and are so thankful that you've decided to spend this time with us today. We're also grateful for the fact that we have so much variety amongst the council, looking at individuals who have been in so many different programs. I know we have individuals who have been in multiple programs, up to 13 or 15 different programs. That said, I think it's important just to acknowledge the wealth of experience that we have here in the room and also online with us today. I know that we have at least 12 members who have experience with our traditional Medicaid program. 10 of whom have been involved with our Kids program, 9 who have been involved with our dental program, 7 with the PASS program, 6 who have been involved with therapy services and SNAP, or the Supplemental Nutrition Assistance Program, which also works closely with Medicaid. And then we have 5 with the TEFRA program, and then 4 in one or more of our waiver services programs. The wealth of knowledge and experience that all of you bring forward is just amazing. And I am truly humbled that you've come here today to be with us and help us inform what we can do to better serve individuals within the program. And the other thing I always like to tell people is that many of you also have experience in other states with other state Medicaid programs, as well as here in Arkansas. And we always like to say, if you've seen one Medicaid program, you've seen one Medicaid program. And with that, every state does things differently, but we know that there's a lot that we can learn from other states as well as from all of you. And with that, just like how, one Medicaid program is not just one person, here in Arkansas, we are blessed to be able to have a wonderful team of people who are also part of making Medicaid happen each and every day. You'll have the opportunity to hear from several of those folks today. We also have a couple folks who are out for doctor's appointments and whatnot, but we wanted to take an opportunity for y'all to get a chance for them to introduce themselves, to be able to put a face with a name, as well as that way as we go forward with the council meeting, you'll get a chance to hear from each of them, both today and at future meetings, about some of the things that we have going on here in Medicaid. And again, I just want to say how excited I am to have each of you here. For many of you, I know that, this may have been your first time reaching out to us with regard to the Medicaid Voice Council, but I can tell, reading through your bios and looking at some of your names, many of you, I can tell you your case files, your your PCSPs, your services have been first and foremost in my mind and literally on my desk as we have tried to, work through different situations and experiences that y'all have had, some positive and unfortunately some negative. And so we want to hear all of that, certainly when it comes to your interactions with us, with our providers, with our contractors, whatever you feel comfortable sharing. And we really hope that you will share with us. We know that this has been a very difficult journey for many of us coming here today. And, we know that this can be very sensitive discussions, and we want you to know that we really appreciate what you can and feel like you're able to share with us, and hope that as we go forward that that we can help support that so that you can continue to give us feedback throughout this process. So I also wanted to point out before we go through the introductions, within your packet today, you have a report that was recently shared with us by the Arkansas Community Organizations. And we would welcome your review and feedback as part of our next meeting. This was something that was presented to us within the last couple weeks, and really, I think, brings about some feedback from the group's perspective with regard to some of the challenges within Medicaid around eligibility, but particularly with regard to access. And so, we definitely want to hear about your experiences as well, but also, want your feedback as you have a chance to review this at the next meeting. And that way, it will help us better understand both some of what's in this report, but also what each of you bring to the table individually. So with that, I will again welcome you for being here today. And thank you for taking the time to participate. And then I will turn it to our Medicaid team to introduce themselves. So Jason, are you taking it from there?
Yeah.
Okay.
Thank you, Don.
All right.
Yeah, so as Don mentioned, that's your first reading assignment, and we'll talk about that report at our next meeting. So as you read it, think about what suggestions are being made that you agree with and really that we need to consider strongly, and what maybe are less important. Kind of prioritize the things you see in that report. So let's do some introductions. We have the leadership of DHS. Much of the leadership is here with you guys today. It's a show of support for this council. They're not going to be at every meeting, but they want to be here for our inaugural meeting, just to show that all these divisions within DHS are behind you, and the suggestions that you bring forward to us are going to be taken seriously. Also, Katie Kaniski is on her way. She came from maybe the furthest away, Pocahontas, and so she is in the vicinity. She may come through those doors at any minute. So we're going to do introductions briefly with all of us, but I wanted to give her an opportunity to get here. So you've met Dawn and Cindy. Amy Webb over here to my left is the director of the Medicaid Control Center. And over to my right, Elizabeth Pittman, to my immediate right. She is the director of medical services. Her assistant director is also here, David Jones. He's on the back row. Let's see. Melissa Weatherton is the director of the Division of Developmental Disabilities Services Director. Jay Hill to her right. He is the Director of Aging, Adult, and Behavioral Services. We have Sarah Schmidt, who you will hear from in just a moment. She's with the Division of Provider Services and Quality Assurance. She's the Deputy Director, and Tammy Rogers, a Program Manager, is with her as well. And Gavin Lesnick, who just helped pass out the reports, is the Interim Director of Communications. So all these folks are here just to say thank you. We appreciate the work you're going to do on this council, and we will take your recommendations seriously. So our first order of business, Sarah Schmidt is going to tell you about some changes that are being proposed or made to the self-direction program. She's going to present. You guys are going to have an opportunity to ask some questions or make some suggestions based on what you hear. So Sarah? Also, some of the folks up here, we're going to have to leave a little early today. They have a meeting with our Attorney General that couldn't be rescheduled. So they may not be here after lunch. Some will. So if you see them leave, that's why they have a meeting that they could not reschedule.
Good morning. My name is Sarah Schmidt. I'm the Deputy Director at the Division of Provider Services and Quality Assurance. Our Director, Martina Smith, couldn't be here today, so I get the privilege of being here in her place. I'm going to talk to you guys a little bit about the self-direction services that DHS provides through the Independent Choices program. And I know Director Staley mentioned that we have a variety of different services and programs here in the room. So just kind of by show of hands, how many of you guys know about self-direction in the state and the Independent Choices program already? Couple of you? Okay. Well, let me give you a little bit of a background and a history of what the program is. So self-direction essentially means that an individual receiving services can be their own agency, so to speak. You do not go through an agency provider that will hire your worker, train them, and bring them into your home. You are essentially your own agency. You will hire and find your own worker. You will train them yourself. You will set their schedule and you will set their pay and so forth. This is what we call being the employer of record and having the employer authority, and then also called the budget authority. So you will go through the same type of assessments that you go through as you do with an agency, to find out how many hours you assess for, how many hours you may need. And then you will get a budget, your monthly budget, and then you will sit down and decide how many hours that equals out to, how much pay you want to pay that individual, which all sounds a little daunting doing that all by yourself if you don't have an agency to help you. But we do have what's called a fiscal agent that will work with you. That fiscal agent is what we kind of call your HR and your payroll assistants. So they will sit down with you. They will help you kind of create that budget, how much you want to pay that individual, what those hours look like. They will help you set up your tax documents, help you process your payroll on a biweekly basis and get all of that set up for you. That is the essence of the self-direction program. But what it does is it takes that agency piece out and it makes you the employer of record, and it gives you that direction and that control over your own services. So right now, self-direction is allowed in two different service types. The state plan personal care, and then personal care and attendant care through the Our Choices program. Both currently have the self-direction option in it. Our fiscal agent right now is handled through Palco. They are our current contractor that helps with that piece. We are currently working on what's called a request for proposal. Our contract with that is coming up through its life cycle, so we are about to put that out for bid to see if there are any other contractors out there across the country that are interested in that. So what we are looking for from you guys are any kind of feedback, any suggestions as we go into looking for a new contractor, looking at growing self-direction, looking at just enhancing what we currently have. If you have any suggestions or feedback for that program, we're all ears. So with that, I will hand you guys the floor. Yes, ma'am. Well, with that, I'm going to bring my guru. I call her my self-direction guru. This is Tammy Rogers.
Hello.
Go ahead, Tammy.
It is actually for ages 21 to 64 when it's in the Our Choices waiver program. And it covers that range.
Is there a program for children? Not at this time.
So if you guys have a question, raise your hand. I know this microphone doesn't help hearing in here, but folks watching at home will be able to hear your question if I get this microphone to you.
Is that something you'd be interested in?
I have two children
Yeah.
at home that are in wheelchairs and can't walk, they can't talk. And me and my husband are their primary caregivers, and I'm not in a placement in a public school setting, but I do have a career, and I would like to have services to where I could hire an individual that I feel would treat my children as well as I do, to be able to come into the home and care for them. I'm not asking for 8 or 10 hours a day, but even half a day,
an assistant to just come in and work with them. And every direction that I've looked, I cannot get any help anywhere.
Frank.
Is there any discussions on adding something like this to the DDS waivers side of things?
I look to Melissa for that.
I knew I was going to be called up here quickly. Hey guys, so many of y'all look very familiar. It was Melissa Stone until just a few weeks ago. So it's good to see some familiar faces. We have over the years, Frank talked about self-direction under the waiver. I think this would be a good opportunity for y'all to help us build that. We've had a couple of hurdles in terms of, the waiver now is under the PASS program. And we've had discussions with the PASSes for at least doing a pilot with families. And I think the biggest thing that we've been trying to work through in researching other states is who would be our PALCO, right? Who would be our fiscal intermediary? And would that sit with the PASS organizations, or would they need to work to do one entity? And so that's why you're not seeing it in there. And then the other thing, just to be honest, when we have moved to the electronic verification system where people had to enter their time during the aging programs, we ran into a couple of hurdles. And so I was waiting on them to work through those before we put our families through that, because it was very difficult for them to implement what we call EV&V, which is this electronic verification system in their homes. But luckily, Dipsqua and Elizabeth and Jay have had to work through all those problems. And so I am hopeful that in the future, we can develop a family pilot, because I do think, I hear from a lot of mothers that would like to have control of some of their budget and be able to do those core services through a self-direction program, and be able to do supported living, respite, those core that someone's in your home, and be in control of that process. So it has definitely been talked about, and maybe y'all can work, now that we have this, y'all can help build it. I'd be welcome for some input, Frank.
I'm originally from Louisiana, and we were part of the Medicaid programs there also. So I've had like they were talking about earlier, you have some people that have been in different states and can kind of compare, and we were on a self-direction. Mm-hmm. And so it was for our children. And so they had a program in place. Now, I don't remember the ins and outs of it, but they did have it set up where you could request to be self-direction, and you could train your workers, and you were given a budget, and they had, I can't remember who exactly was their fiscal agent, but they had it set up through that. So I hear what other people are saying is I did have a little bit of experience before we moved with setting that up. And it is daunting for parents, but I think with a fiscal agent, it really was better, especially because we lived in a really rural area. And I work for an organization that services a lot of people in rural areas. And the complaint I keep getting is we can't find workers, we can't find people. The organizations that we're using for our care can't find anybody, but I know somebody who could, or I could do this or could do that, and things of that nature. And so maybe doing the self-direction, it also gave them the ability to pick how many hours and how much they paid that person. Mm-hmm. So they might be able to pay them a little bit more and make it where they can find higher quality workers, because, wages are another issue that we've talked about for some of the respite care programs.
I think that's a really good point. And I think right now, if you found someone that you wanted to work as staff under the CES waiver, then they could go work for a provider like Easter Seals or Pathfinders, and they could train them, but you are not in control of what they are paid. And I think that is the distinction that self-direction is, like Sarah was talking about, is setting that budget.
I don't know if now is exactly the time for this question, but going back to the implementation of a intermediary, could you not use the PASS coordinator that each individual has, taking some of the load off the department itself? Because also in that in there you would have somebody that was familiar with each individual client, knew their needs, knew what they were looking for, and things like that.
So for those of you not familiar with what Nathan's talking about, so under our PASS programs, each member of a PASS has a care coordinator, and his suggestion is looking at the care coordinator to hold those funds as the fiscal intermediary. And I think that's a good idea that we will definitely need to discuss.
Why are some children on PASS and some children on Medicaid?
Okay. Let me get me a chair. No, yeah. Let's where is it?
Dawn left.
She did. Okay, I'll wing this one. No, I know the answer. I was just going to let somebody higher up than me answer. So for the PASS program, in order to be in the PASS, there's a couple of different qualifiers. So the PASS is made up of members who have some pretty significant behavioral health needs, and then children and adults who have been deemed to be institutional level of care due to their intellectual disability. So in order for a child or an adult with IDD to qualify for the PASS, the trigger point is you were either on the community and employment support waiver or you're on the wait list receiving some core Medicaid services. We go ahead and put you in the PASS because you get a care coordinator to help manage the services that you're receiving. We also have people who live in intermediate care facilities, which are 24-hour facilities for people with IDD that need to live there 24 hours a day due to their care needs. So those individuals are also in the PASS. Now for behavioral health, it's different. You qualify based on an independent assessment that your behavioral health needs are significant enough where you could, your life could be enhanced through some intensive services in the home and community, and that is why you are in the PASS program. So it's different on how you get in, but it's based on functional needs, and people in the PASS functionally can benefit from home and community-based services.
Bradley's got a question over here. Again, when you have a question, just raise your hand. I'll be watching and I'll see you.
And this is actually, excuse me, this is actually not a question for me. It's for a friend I got. But the program I'm on is the AR Choices, and it's a good program. It could stand to be improved because everything can be improved some ways. But for the most part, I'm happy with it. But when we have to go to the hospital, we lose our caregivers. And the reason we lose them is they say, it's the nurse's job to take care of you. No, it's not. It's the nurse's job to get you well, not be your hands and feet. And my friend I was talking about, he had to have surgery, and he was in the room, and they just about let him smother because they wasn't watching him, and they didn't know he can't turn himself over.
Oh, I can. Yeah, I mean.
You can talk about that. So with the hospital, for instance, if a beneficiary is in the hospital, that facility will be billing for services that they provide. If it's a Medicaid beneficiary, for instance. And so under AR Choices, you don't necessarily lose your caregivers, but those hospitals that facility is responsible for the care that's provided, for the safety, to ensuring that. The instance that you're speaking of would be something that would need to be reviewed, certainly, and looked at. It was when your friend would return home, his caregivers would resume providing that care and would be reimbursed. The services the facility or the provider would continue being reimbursed for services that they provide. But while they're at a facility or a hospital, that entity is who takes responsibility.
But if I'm in the hospital and I drop my fork or whatever, they're not going to come and pick it up 100 times a day.
Right. What I want to do is to review that, and we will look at that. And so, Bradley, if I can get that information of this instance that you're speaking of, then that'll let me address that in my division. and we can take a hard look at that to see if there's something that we can do systemically to make improvements in that
I
way.
understand what you're saying, and I'm not arguing with you, but it's
Right.
they're there to get you well and back on your feet, so to speak, and back home. They're not there to be your hands and feet.
Completely understand.
And I
So,
think,
yes.
and I wish Jay and I and Martina, who was out today and Sarah's filling in, we worked with Representative Mayberry, and she passed a bill last session that was called No Patient Left Alone. And because we were seeing that this was happening when the pandemic hit, that the hospitals were putting a lot of restrictions on who could go with people into the hospital once you turned 18. And so she actually passed a state law that Sarah's office monitors for our facilities to make sure that they're letting people in to be with patients. And I know they have the law also applies to hospitals. So hopefully it's not happening now. It was happening at the beginning.
But I do totally understand that the hospital's there to get you well. But I was just thinking your caregivers do more than just the basic needs like a nurse would in a hospital.
They do. And you're raising a really good point, and that's why I think we will go back and look at that. You know, I think of it in the same way as I mentioned, somebody who had, like when my mother was in the hospital recently, we flew down and wanted to be there in the hospital with her. Not that what we were doing was getting her well, but we were making sure that when there wasn't somebody in the room, that one of us was there and knew what she needed and how she needed it. So that's what you're raising, and we will definitely look at that. Thank you.
We could probably be here all day asking questions.
I'll cut it off at some point, Jerry.
But thank you. I want to ask a question. Is there any way we could get a org chart for the different department and a list of programs within DHS and the contact people that are associated with those programs? So sometimes there are programs that maybe multiple departments coordinate on it. And that would be very helpful to help us inquire to the right people about different things instead of bringing everybody in a room and constantly asking questions. I like email myself, but
That may be part of my role, to be the funnel for your questions, and then I will disperse and they'll get back to me and I'll put it back out to you. That's probably going to be how it works.
Well,
we can also get you a list of the names of the people who are leading each program and
an explanation of what the programs are.
Yeah, definitely.
Then that way we could be better decision makers and come up with better ideas.
Good suggestion, Jerry.
Just gonna add something to what he said. I agree. I didn't realize and didn't think about that. A lot of times our caregivers can't go with us to things like that. But I have a son who's autistic, and he's a two-person. Sometimes if he's going for something like blood work or he had to have a sedated dental procedure, you were only allowed one person. But if he has a meltdown, they don't have health providers on staff just waiting for a child to have an issue. So not being able to bring a caregiver or my husband or anybody else with me, that is a problem, because as he gets older, these people aren't going to be on staff to help manage that. And so then not being able to have a caregiver there that knows him and knows how to handle those situations is really going to make access in healthcare really difficult. So it's not something I didn't thought about until he brought it up, that's something I'm going to have to worry about, is that we're not going to be, my child is not going to be able to have his caregiver once he hits the hospital. So that is difficult, and I'm glad that he brought it up, because that's really important to think about.
Any other questions around the room, Nathan?
I just wanted to add to that. The gentleman mentioned an incident from a secondhand experience, if you will. But I can say from a firsthand experience that has happened to me as well. And for someone that's in my shoes, there is no one outside of my professional staff. I don't have family. Friends aren't going to come do that. My staff is it. There's no one else. So that would definitely be something worth looking into getting resolved, or something of that nature.
Thank you, Nathan.
Hi, my name is Katie, and I'm from Pocahontas, Arkansas. And my question is there any way that this program can help DAG local in my community? Because there are too many Marshallese people that they cannot speak, they cannot read, write. Is there any way that you guys can help out my community? Because right now, one of my brother is he's been disabled for like almost 4 years, and we have to reach out to ACOM in Springdale, ask them to help him out. Because every time he apply for Medicaid, there's too many things, and he works from 8 till 5. He doesn't have any time. So is there any way you guys can help? Thank you.
I guess the question is, there's a lot of Marshallese in Northwest Arkansas. Ketty's in Northeast Arkansas. There's not as much help for the Marshallese community there, or maybe in other parts of the state. If there's any answers for, that any of the panelists have.
I don't know that I have an answer to it, but because I was looking to see Mary. Mary's not here, but I'm here. Oh, hey, Ruthie. Okay, so. Yes.
But you mentioned that your brother works long hours, and Department of Human Services, we can schedule around his work hours. So if he need a late appointment, we have been to the point where we can accommodate that. So don't allow that to keep you all from getting the benefits that you need. Just contact the county office and let them know that. And then also, if he want to do his appointment during his lunch break, we also have done that as well. So there are times when we can't reach out.
So, and it sounds.
So you all need transportation and all of that, yeah.
Instead of keeping in too many papers to fill out, is there any other ways? I mean.
Now, they also, the clients also can go online and make application. And if they have other family members that can assist them with that, they can also do that. So if they cannot come in, they can do the application online, and then we will give them a phone interview. They have no need to come to the county office if they do not want to. So that might help you all there.
Ruthie, the application is online. It can be translated into Marshallese.
Yes,
correct?
ma'am. Yes.
Hi, good afternoon. My name is Erica, and I represent the southwest area of Arkansas, specifically DeQueen, Sevier County. And to add on to what she just mentioned, there's a language barrier that does exist. I am Latina, I'm Hispanic, and currently there is at least 53% Hispanics in Southwest Arkansas. We are now at least halfway part of the majority, and it keeps growing. We also have a population of the Marshallese is there. I know that the fastest growing Marshallese population is up north, but I think we're the second. And so I would agree with her. I think, in my personal opinion, if you ask me, how can we start fixing those issues in regards to the language barrier, is we need people that represent us in those offices. So for example, and I love everybody in Southwest Arkansas. I love the Ms. Reynolds, everybody there in the DHS office. They're all great. You go find the help, you're going to find it. But the reality is, if they don't look like me, am I going to go ask for help? And so by having people maybe within the offices that speak our language and that look like us, that would be a barrier that we could easily overcome and help the community, especially of Southwest Arkansas in this case, and of North Arkansas, when we are seeing that the minorities exist and that they're there. So that would be my suggestion, and that's also an issue that I see in Southwest Arkansas myself. Currently, if I go to the DHS office, I am bilingual, but what if they're not bilingual? What if they're there and they cannot speak the English language? That is also an issue that I'm hearing that I'm to voice my concern about. I don't know if there's any possible way to just create jobs with just bilinguals. I don't know. I know that in Southwest Arkansas, our mayor just recently hired his first ever bilingual person, because he said, Erika, y'all are more than half, a little more than half, and it's going to keep growing. We've got to be ready. We've got to be prepared. And so I'm just here to voice too that in Southwest Arkansas, that is an issue. And yes, the application may be online, but how many of them can actually sit down? How many of them can actually find a computer? How many of them actually have internet at home? And while it's easy for me to just pull it up, I can't just assume that it's going to be as accessible to everybody else. And so I think there's just a lot of little things. This is a great program, but there's a lot of things that I think we could sit down and share and say, hey, not everybody has a computer. Maybe not everybody can just easily find somewhere to go apply. It's just, in my opinion, if we can have somebody at the offices that look like us and speak our language, that's a good start.
All right,
Really-
one more question during
Okay.
this.
And while you're going over
I'm sorry,
there,
Cindy.
no, I was just gonna say, while you're going over there, Jason handed y'all a report from an organization that came the other day, and they are raising some of the same issues y'all are raising, access issues, particularly access around eligibility. And so your points are really great. One of the things, Jason, the next meeting, if we could have that meeting be partly around eligibility and ideas, input around potentially improving access, have Mary and Ruthie here. I know they have also been playing with some ideas around almost community satellites, right? That are not just the main office, but places where we go into a community and perhaps do something. I mean, that's just one idea they've been playing with. But perhaps having a good discussion around some of the issues y'all see around eligibility and access to the services in that way, and a little brainstorming and input and back and forth. If everybody wants to think about some of the issues you're seeing, really great points, and kind of emphasizes that community issue we've been talking about. Good, thank y'all.
I just wanted to bring the conversation back to where we started with this agenda item with Sarah's presentation about self-direction. That was new to me. I have a child that's part of the TEFRA program and also on a pass, so I'm not there yet. But in thinking ahead, as us parents always are, about what happens next when our kids become adults, I just wanted to throw out there that while it may be a great program and you want to strengthen it to the best of your ability, just remember that not every family will want to take that on. And I just hope that it will always be an option to have somebody else do that. Because I know for me, if you tell me one more thing that I can do, I really kind of want to shut you down. So.
Absolutely. We never want it to be a one or, one option. We want you guys to always have that choice. Yeah.
Well, Sarah, thank you. Thank you for that presentation. And each meeting, based on your suggestions, we can invite whoever we want within DHS to come and speak to you guys on the topics that you want to hear about. So keep that in mind, Jerry, as we distribute the information about the leaders in these different divisions. You can contact myself, our chairperson, and then we can formulate an agenda based on what you guys want to talk about. This is your council. We're going to formulate the agenda on what interests you and where you want us to spend our attention. So the top of the agenda had introductions. I delayed those to allow Ketty a little extra time to get here. So what we're going to do right now before lunch is I'm going to take the microphone. We're going to go around the room. Just introduce yourself, tell what city you're from, and maybe in a sentence or two why you want to be a part of this council. All right? Start with Bradley.
I'm Bradley Ledgerwood. I live in Cache, Arkansas, and I'm on the city council in Cache, and that was part of the reason I wanted to be on here, is because I already have experience with dealing with people.
All right. Thank you, Bradley.
I'm Deronda Williams from District 4, Prescott, Arkansas, and I desire to be on this council not only to be a voice, but to give a voice.
Oh, that's great. I got to follow that. I'm Amanda Sanders, and this will not be that eloquent. I'm on the Governor's Council for Developmental Disabilities, and I got on this council as well, and I'm really excited to be here and meet everybody. And I have a son who has disabilities, and my uncle was also disabled, and I've always had a heart for people with disabilities, and I want to make a difference.
And Amanda, you traveled a good distance. Tell
I came from Mountain Homes, 4 hours. Yeah.
My name is Michelle Lappin. I'm from Searcy. I'm the mother of 3 children with disabilities, and we've had we've used various Medicaid programs. We're originally from Louisiana. So we've lived here for about 2 years. So trying to make the transition to new services. I'm also a parent mentor for the Center for Exceptional Families, and we help families and schools to meet the needs of children with disabilities. And so in doing that, we also have a lot of families reaching out to us and trying to educate them on the programs that are available in their area and how to access those. And I work in the Delta area, which is extremely rural. There aren't a lot of services, and there's a lot of struggling families. And so I definitely wanted to come and not only represent my family, but also represent those families that are struggling to find and access these services for their kids and for their family members.
I'm Laura Cartwright. I live up in the Fayetteville area from Farmington, little bedroom community. It's not so little anymore, but my husband and I have 7 boys, 4 of which were adopted. So we've navigated Medicaid from some different perspectives. Our youngest one has developmental disabilities and behavioral issues. And I'm also an educator for K through 3 self-contained class. And so I interact with therapists in the schools. I interact with parents and can see a lot of frustrations that they have, frustrations that I've had, and I hope to be a voice for them.
Hello, my name is Reverend Jerry Watson. I've been an activist for about 50 years, mostly working with low-income people. I'm also a caregiver for my sister, actually for my whole family, but anyway. My background is in engineering and computer science, and I've helped a lot of organizations succeed, and I would like to help DHS succeed.
Where are you from, Jerry?
I'm from Pine Bluff, Arkansas.
All right, I'm Allison Caballero. I'm from here in Little Rock. Like I mentioned, I have a daughter with some special needs. She's got a rare chromosomal abnormality that really doesn't fit into a syndrome, although now it sort of does. I'm learning every day, and I hope to continue that learning by being part of this group. I've already done that. DeAndrea and I were already exchanging some good information before the session started, so definitely hope to learn, but hope to help others learn, and just really grateful for the opportunity to share with DHS. There is so much to learn as a human being in general, but as a parent of a child with special needs, and it hasn't stopped. My daughter is 14, and I still have so many things that I don't know. So if I can help, shape some programming that helps people not struggle and throw their hands up in the air because they didn't know who to ask or didn't know what to ask, that would be a huge win for me.
Hello, everyone. I'm Dr. DeAndrea Bass Kerrigan. I'm from Conway. I wanted to be in this program because I now have almost an 18-year-old in May with cerebral palsy and IDD. I've been working in some kind of advocacy role for a long time. I was with Arkansas Rehab Services for about 15 years. And now I'm the department chair of the behavioral science department at CVC. So advocacy is in my heart. So I just want to be in a position where I can help other parents who want to know more. And so that's why I'm here.
My name is Frank Helmer, and I'm a person living with autism. And I'm originally from Russellville, Arkansas, but moved to Little Rock in 2020 to take a data analyst job at a large health insurer. But anyway, I'm here because I've had experience with various DHS services from Arkansas Works, and then to Medicaid proper, and then to getting into an ICF, and then all that stuff. And I graduated from Arkansas Tech with a degree in accounting and business data analytics. And And I'm really thankful for the Arkansas Workers with Disabilities program that allows me to have a full-time work to the best of my potential and still keep my waiver staff. And so I want to be a voice for both my business thinking. I passed the CPA exam, by the way, but with scores in all the 90s. But anyway, sorry. I hope I'm full of words, but anyway. But anyway, to wrap up, I'm just wanting to be a voice. Since I've had that frontline experience of being on the waiver, I want to be a voice for both waiver clients and the DPS or DSPs that help us do what we need.
Hi, everybody. And as I had mentioned just a few minutes earlier, my name is Erica Monroe. I'm from Sevier County, specifically small town of DeQueen, Arkansas. And I'm glad to be here. I would like to thank everybody for this opportunity. I do currently work as Director of Student Success and Enrichment. The center is called Center for Student Success. As part of what I do is we provide students, low-income students specifically, with weekly food. And so besides just giving them a weekly food bag, we also provide them with $10 gift card for the cafe. And so a lot of times I'll find myself writing small grants that will keep bringing that kind of money in or filter that kind of money into the center. By the way, it's UA Cossatot College. And so that's one of the main reasons why I'm here. I want to see how we can help our students. I want to know and understand how and be the voice for this, not just students, but also Latino community, the African American community, the Marshallese community, and the community in general, everybody else. Besides working with the college, I also I'm a board member for Central Arkansas Development Council. So everything I do, my life, is working with low-income families and seeing how we can better assist them. So thank you for having me here.
Hi, my name is Kerry Kaniski, and I'm from Pocahontas, Arkansas. And I applied for the job because I want to be the voice for my community. And I came here to U.S. in 2001, and I've been working as a certified nurse for almost 17 years. Right now, I'm working as a nutrition in Lawrence Memorial Hospital in Walnut Ridge, and I thank you all for. I was late because I lost earlier. Thank you for being patient with me, and I'm here for my people, and thank you all.
My name is Reba Shipley, and I'm from Jonesboro, Arkansas. I'm a mother to 9, 4 with disabilities, 7 we've adopted. I'm very grateful for my children. I'm very grateful for my community. I'm very grateful for the Medicaid program, because without that program, I don't know what we would do. And I'm just being honest. But I'm here in support of my children. We've had several difficulties, but I'm also here in support of other families in our area that I know struggle getting services for their children. And, it's not easy. And I know that your job is not easy. I see it every day, like at our local DHS office, because we deal with some of the staff there. It's not easy. The burden is heavy. They take it home with them. They see faces at night. They struggle. And then we as parents, we struggle because we're focusing on our children. And it's just a hurdle that we're just all going to have to come together and basically join forces to help each other. So that's why I'm here.
Well said. I was going to say something similar. My name is Nathan Dye. I come from Area 1. I live in Fort Smith, Arkansas. I also work in education. I joined this council to help bridge the gap between program administrators and those who actually use the service. And, well, who better to learn from than someone that experiences it firsthand? I'm hoping this will give us all some insight on how all of us can improve. Everyone in this room, from the way we communicate to the way that we run the program, because as someone said earlier, we can all use improvement somewhere.
All right, and the other people around the table, Landon, Tammy, no, what is it? Nikki, and the Ledgerwoods, they're caregivers who help our council members get here. And the two council members who could not be here today, Debbie Eckel is from Little Rock, Cassandra Glover's from Searcy. We look forward to having them here at our May meeting. Before we break for lunch, one final order of business, I want you all to consider if you would like to serve as the co-chairperson for 2022. Because we're already into the month, we're in the third month of the year, we have selected a chairperson to serve for the remainder of this year, and that is Allison. Based on her knowledge, her health knowledge, we looked at all the resumes, we offered it to her, she said she'd be happy to do that. But we need a co-chairperson who will then take over next year as chairperson of the council. We'll invite 15 new members on the council next year, and we'll elect a co-chairperson to serve with whoever we elect today as co-chairperson, who will be chairperson next year. So think about if that's something you want to do. We're going to allow you all to make your pitch to be co-chairperson after in the second half of our meeting today. And we'll hear more from Allison in the second half of our meeting as well. But right now we need to break for lunch. So we have lunch prepared. One of you brought your own lunch, I believe. And so we'll have at it, and we'll reconvene in 30 minutes. We're going to go into a discussion on rules of engagement, of how we want to engage each other as council members. So Allison, why don't you come around for this one? I'll take notes. You lead the discussion as chairperson. And this is just going to be a free-flowing 15, 20-minute discussion on how we want to communicate with one another during these council meetings. And so,
Yay. All right. Can I just use this one so I don't have to? Okay. Is it on? Awesome. So if you've been to any kind of a focus group or group meeting, sometimes you hear these called ground rules, but I don't like the word rules so much because we get to deal with that enough with our Medicaid work, don't we? There's all kinds of rules and policies. So I really like, rules of engagement. Let's focus on the word engagement. So this is, like Jason said, just how we're going to function as a group. And so I'm going to throw out a word or two, and then you all can come up with what you think some of those rules, and let's call them rules, but they're rules we all agree to live with, right? What some of those rules should be. So I'm going to give you a word, and then I want you to tell me if a rule pops into your mind that we should have as a group. So the first word is confidentiality. Anybody think of
raise your hand if you have a comment. I'll bring the microphone.
a rule that we should have related to confidentiality?
I do, because while the bigger picture of the council is to represent the state, we may or may not be sharing personal details while we're in this room or any other room that may represent this council, sharing personal details about ourselves and our experiences that may or may not necessarily need to be heard by everyone else. So in my opinion, I think we should.
Okay, so I've got a couple of follow-up questions on that. So I know that our meetings are going to be open to the public. So we have some limits on confidentiality, right? And so I think to your point, one thing that we should all kind of adopt as our own personal rule is don't share something that you're not okay going out to the public, because we don't know who's on the other end of these screens watching, right? So if you wouldn't be happy for it to go out, you probably don't need to share it here. You're in a great place, though, because you're making contacts within DHS that you might share things of a more personal nature. But I do hope people will feel free to share those things as much as you're comfortable with, because that's how we're really going to help and fulfill our mission here. So thanks for saying that. But also on the note of confidentiality, did somebody else have one? I thought I saw another hand up. Michelle, did I see your hand up?
The question is, what is in reference to confidentiality? Is it towards,
that was really good news.
Is it email? Is it in the public meeting part? What are we discussing both? Because we also now have emails, and those can be requested by the public. So
that's right. So anything that we share via email, our new DHS email, and anything that we share here could be requested and could be publicly accessed. So it's both, and that's a great question. Go ahead.
Yes, we are a government agency, public agency. So, as a rule of thumb, I would consider everything that we say on a public forum.
That's right.
Is public information. If we want to share personal information, then just know that that personal information is going to become public.
That's right. So I
As
think
for
one
the
of our
emails-
rules is don't share anything that you don't want shared with the public.
Right. And as for the emails, if you want to share something personal, then don't use the email they're giving us.
Mhm.
Use your private email to send it to whoever you want to.
But
Then
know that if you send it to dhs.ar.gov, that's also public
One of the reasons we set
queryable.
up you all with emails just for this council is because if there was a Freedom of Information Act request for emails between me and you, your personal email, you don't want all that dragged into it. We only want to have your council email brought into it. They don't, you don't need a reporter for the Democrat Gazette looking at everything in your personal email. But that could happen if we use personal emails. That's why we're setting up emails just for council business.
Okay, Bradley's got a comment over here, if we could.
I've got a question for you, Jason, about what you just said.
Sure.
The emails that you have sent us up until now, do we need to transfer them to the new email account for Freedom of Information request?
That's a good question, and I'm not sure. I think if someone were to make a request right now, they could be brought in. So if you do move them, it would take that out. So it's a good idea. I don't personally, as a former journalist, think we've done enough as a council to warrant a Freedom of Information Act request, but you never know. You never know what a reporter's going to hear or want to try to find out. So
I just wondered about that. That was just
that's a good suggestion that Bradley has. You may want to transfer those over, and then your personal email will be devoid of anything council related, and it won't be an issue for you.
Okay. So there's not a whole lot with regard to confidentiality. And I think that kind of leads me to the next word that's on my mind, which is respect, and how we can all operate in a way that we are mutually respectful of each other and of the system that brought us here. So any thoughts about rules of engagement related to respect? Yes, Laura.
I do think that whenever someone is speaking, that we do not interrupt them. We do allow them to finish. I mean, if we do need to look at time limits, that's okay, if we feel like that's an important thing. And attempting to stay on topic to what the agenda has been written down.
Okay.
That's why I suggested Robert's Rules of Order, because every government agency, whether you're at the city council level or you at the legislature level or even some appointed commissions, you generally have to go by Robert's Rules of Order. In that case, everyone gets a chance to speak, based on whatever time limit the chair sets for each person. If you don't want to speak, you can just say pass or whatever. That way, everybody gets a chance to contribute. You can't interrupt people unless you have a point of information to the chair or something, but that doesn't limit the person who's speaking's time. Once the point is done, then they can continue to speak, so they have their full time.
Mm-hmm.
But just blatantly interrupting somebody and say, I disagree with that. You can't do that.
Okay.
That's rude.
All right. So I think I'm hearing two similar threads here of, let the person speak out what they need to speak out. There might be an exception where the chairperson or Jason as the timekeeper might need to jump in and say, we probably need to pause this right here and continue this later because we do have some other agenda items to get to. So being respectful of the agenda, trying to stay within the time limits of the agenda. And I also heard something else from you, Jerry, that was speak when you want to speak. So I think, don't feel compelled to have an opinion or a comment about everything, but speak when you have something to add. I would also throw out there that in some ways, I think it's helpful if we speak up when we agree with somebody and when we disagree with somebody. So earlier, when Bradley mentioned the hospital caregiving situation, a few other people kind of jumped in and said, yeah, that's an issue for me too. And I think that unless we do that, then the DHS team doesn't know if this is an isolated incident or if this is something that's affecting, a large body of the Medicaid population. And so, I don't, to the point of, not just making it a free for all, what's the best way for us to do that? I mean, should we just be nodding heads or, do we need some kind of way to say me too without going into a lot of detail? What do you all think about that? Jason's got the mic. He's in charge.
Well, I just had an idea when we're discussing something like this and it's an issue like I brought up or something that people seem like they may have feedback to, because you can kind of tell from the reactions after the initial discussion or whatever. Could we open the floor up to take comments and stuff?
Yes, I think I like that. And as chair, I'm happy to do that, to say we just heard an example of a situation, have others in the room experience that. Okay, I like that. Okay, I'm sorry, go ahead, Jerry.
Everything we say is in this meeting room, is on video, sent out to the public, public record. So if you don't want to embarrass yourself, act appropriately.
Right. So in that vein of respect, is there anything else? So, speak up, let others speak, stay on track, don't interrupt. Is there anything else? Yes, Erica.
I'm sure we all know this, but maybe just in writing, have something where it states that we're going to be respectful of each other's comments. So I may not agree with Kitty, but I'm going to be respectful as to what her comment is, because what matters to her may not matter to me, but yet I think it still needs to be heard. And I think we're going to shut opinions down if we start criticizing or being negative in some sort of way against somebody's comment or suggestion or concern.
Okay, so be positive and support everyone in their voicing of their opinions. Okay, thanks. Michelle?
Doing the hand thing, or is there another way that we want to do that to speak? I mean, I think it's working well.
I think it's working well, and because we know we need to pass the mic for the online audience, I think that's probably the best way to go, if that's okay with everybody. Okay. All right. The last kind of trigger word I have is helpful. How can we work with each other in a way that is helpful to the reason we are all here, which is to make Medicaid programs and services as strong as they can be? How can we be helpful? What can we commit to as a body to be helpful? Is your hand up, Nathan? Yes. All right. Thank you.
Honestly, it almost sounds oversimplified, but I would just say to continue to do what we've been doing. Like when someone needs help and we can't necessarily reach someone at an organization or just have another council member help them. If they know the answer, let them provide the answer, because the faster you can get the answer is the faster you have the knowledge and you can do what you need to do.
Okay. So I'm hearing in that and kind of, speak up for the things that you need. And that kind of relates back to the earlier conversation. If you don't understand something, speak up and ask for clarification. If they ask us to read something between meetings, can we commit to reading it so that we can come to the conversation ready to contribute? And then if we see these opportunities to help each other, and I agree, Nathan, we've been doing that. I've already gotten so much help from my table mates this morning about personal things that I've brought up. They've said, oh yeah, well, you need to check out this and that. And so I think being helpful to each other in the moment is excellent. Any other thoughts about how we can be helpful? Jerry?
I think we should be careful about distinguishing the difference between opinions and facts. Try to gain, if you have an interest, try to get the facts straight and don't just share misinformation or personal opinion, because you could lead some people astray. Then you find out that it wasn't true. It might end up becoming policy somewhere and it hurts somebody.
Okay, so being honest about where your comments are coming from, single personal experience, opinion, read it in a policy and so on, so we know kind of where those comments are coming from.
We need to be open and honest about what we need here, but we also need to be willing to listen to the DHS's side. You may not like what DHS has to say, but we need to give them the respect and courtesy to listen to them too if we want them to do the same thing for us in the council.
Okay, so respecting DHS in addition to each other. They don't have to have us here. It's a huge investment of their time and energy to have us here. So the fact that they've invested tells me they really want us here. So we can reciprocate that for sure. Okay. Any other, I'll kind of go back over our list. Yes, Frank's got a addition there.
Making sure that what we say, because our time here is rather limited, so making sure that what we say adds value, and maybe actually researching the reading assignments to the best of our abilities,
Yes.
not just taking our favorite parts and just running with that and then discarding the rest.
Okay. So everything that we've kind of talked about, most of what we've talked about has to do with what we do in the room. We've touched a little bit on what we do between meetings, but I want to open that up as well. And we all have our new email addresses. So is that going to be the primary way that we need to communicate with each other, is through those email addresses? Okay. So if you have questions about the next meeting or ideas for the agenda and that sort of thing, you would send those to Jason or myself, and we'll meet and kind of coordinate that. We use text a little bit this time too. Is that something we plan to continue?
What does the council feel? Some love texting, some don't. It's kind of an age thing sometimes.
I'm personally not opposed to that here.
Not opposed?
No.
Not opposed?
I like the group texting.
I think that we could do both. I mean, I think emails are more formal. Maybe texting could be kind of more informal.
Can I make a suggestion that the texting, make sure that it's limited though, because it will interrupt people's workday. Even though I have it on silent, it goes. It's like,
Anybody else agree with what Laura just said? Okay.
So maybe we could limit it to, like, we're doing the text saying, hey, here's the reminder of the next meeting, or did you, make it very business.
I agree. Just email you.
And then if, right, that would.
Yeah, and so like if we were to receive a text message, a group text that says, quick reminder, next meeting is Tuesday at 11, don't forget we're going to the White Building. If you have a question about that, or there's no need to write back to the group, if you would just send those directly to Jason, that would be helpful.
Coming in a few minutes late.
Yeah, that can go directly to Jason via text or email. But
When it comes to,
I'm sorry, you have the mic. I'm so sorry.
When it comes to confidentiality, my concern is, again, that opens my cell phone up to requests, because text messages are also FOIable, so I prefer email if possible. I usually try not to respond because I use my personal phone for work purposes, and I don't want all of my other business now open up to an FOI.
Great.
That was my question myself.
Okay.
Okay.
I just more or less had a question about their concerns about the phones, but if we're doing a group text, wouldn't the FOI request go to the DHS phone? Because all the text will be on whoever you're texting to here at DHS.
Yeah, it's kind of a spider web thing. It starts with my phone, but then they want to know where all the other phones were. So yeah, that can be, it could drag your phones in.
Yeah, the limit on texting, if you get a text message that's been sent out to the whole group and you reply to that text message, it's going to the whole group. With email, you can send email to specific people. And if I want to communicate with one particular person, I can communicate with them, whereas everybody else may not be interested in that. And like you said, it's disrupt if you're at work and your phone is constantly going off every time a text message comes in.
Jason hurt my feelings a little bit saying it might be an age-related preference. Thank you. I know where I stand now.
My son and his friends, all they do is text.
I know.
Nathan's the youngest member of the group. He's probably a big texter, but
He was the first one to say not
He doesn't
opposed, so.
understand. I'm okay with
Nathan, between us, we have proven his point.
I only said not opposed because it's really convenient.
Yes.
So I think what I'm hearing is we are not going to text very much, if at all. It would maybe just a reminder of the meeting coming up next week, because there are 2 months between meetings. The only time we'll use a group text is for something like that, and we'll use email as the primary method of communication.
Excellent. Okay, Michelle, did you still have something to add to that? Okay.
Do we want to do we want to have an opt-out or a paper where we fill out where some of us don't even want the reminder? Because like I said, just replying to that reminder makes you part of that text, and some people may not even want that reminder because they don't want to open themselves up for Freedom of Information Act. Should we have like a form we fill out with our preference?
I think you can just let Jason know that via email and he can take you off that text
Yeah,
thread.
anyone who doesn't ever want to get a text
Yeah.
related to the council, let me know and I'll make sure you don't.
Perfect.
Okay.
All right, I'm going to quickly kind of summarize where we are. I know we have a couple of more agenda items and we need to be out of here on time. And that's another rule of engagement that I would like for us to entertain is let's try to start on time and end on time, because goodness, for those of you who drove such a long way, I know you want to get back in time for dinner. So let's try to start and end on time. But just to quickly summarize these, and then I know we'll get them written up and into our kind of charter before the next meeting. Confidentiality, just remember not to share anything you wouldn't want to go public. To be respectful and helpful, I'll kind of lump those two things together. We let everyone speak, and unless time is prohibitive, we let them finish their thought. We will all speak whenever we have something to say to add value. We will also speak up if asked to agree or disagree to kind of give some more sense of how many of us are dealing with the issue that was brought up. We will be respectful of the DHS staff and the investment that they're making with us, recognizing that they're coming with a different set of experience and needs than we are. We'll be open and honest about what our needs are. When we speak up with a need, we'll be clear whether we're speaking from personal experience versus sharing an opinion versus sharing something that we've read, just so we can be accurate with what we're saying and where it's coming from. We will disagree with each other respectfully, and we will stay on topic. And then do what we can to support each other on a personal level. And then other communication things, we will rely primarily on the email provided to us by the group today, keeping in mind that everything is reportable or requestable, and we'll minimize the use of text and minimize the use of reply alls in general to, if we have a specific question to one person, to direct it to that person. Did I get most of it? All right. Jason, back to you.
Well, you could stay up here for this as well. So I asked you earlier to consider if you want to serve as co-chairperson for 2022 and then become chairperson in 2023. So by a show of hands, if anyone's interested in that, let's see who would like to be considered for that role. Jerry? Anybody else? Frank? Nathan? Okay. So you three gentlemen, I'm going to give you each 2 minutes to make your best sales pitch to the group. And then we're going to have a quick election and we're going to decide who the co-chairperson will be for this year and who will serve as chairperson for next year. So does anyone have a preference? So who wants to go first? Allison?
Just really quickly, just so everybody knows
we
you all
need
know
to
what you
define
might
the
be
role.
signing up for, and just so you all know what you're voting for. the chairperson, I will generally lead meetings, but at some point I may start alternating that with the co-chairperson so they get their feet wet with that so they can do it next year. My hope is that the co-chairperson and I and Jason will have a debrief meeting after each of these meetings to talk about how things went and what we want to do together at the next meeting. So we'll do some meeting planning together. It shouldn't be a huge expense of your time in between meetings, but it will be a little bit so that we can prepare and be ready for the next meeting.
We'll need you to be dependable because next year you'll be at every meeting and you'll be leading those meetings. And so keep that in mind. And so Nathan, Frank, Jerry, anybody want to go first? Nope. You'd like to be considered as well? Okay. So four candidates for consideration. We'll just start with Nathan and go around the room then.
I'm so happy about that. I was concerned that we would have no hands go up. Plan B.
All right, Nathan, the floor is yours.
I would like the opportunity to be considered because I'm very excited for what this council has in store. And I feel like if it continues on the path that it's on, we are in line for great success. And I do have experience serving on other executive boards and different organizations, so I do know what to expect. And I will be prepared and very organized and honestly ready for whatever's coming at me.
Thank you, Nathan.
I would like to be considered because I want to learn how to do this so that I can even spread this through the community where I live. So I don't want to just be helpful here. I want to learn and improve and to go on and assist others because I know after a couple of years we'll be gone, not be able to serve on the committee anymore, but we can still take what we've learned and encourage those around us and help those in our community. And that's what I would like to do.
Frank?
Hello, my name is Frank Helmer, and I would like to be considered for the role of co-chairman person for the 22 and the chair of 23 because I, as a person with autism, I have firsthand experience with the disability system and the psychological impacts that people go through waiting on that stuff. And through my college education, I understand the business and economic impacts and kind of where DHS would be coming in with their ideas and rebuttals and things and how to compromise that. And I also have some I have an associate's in information technology, so I know a bit about technology as well.
My name is Jerry Watson. I have a lot of experience working with people on committees and groups and councils, and I'm a strong people person, and I believe in that it's not about me. It's about all of us. And so facilitating I'm a person who loves to facilitate discussion. The less I say, the better. I want everybody to be able to contribute. And coming from a technology background, I know the power of email and groups and so forth. And I would love for us to be very successful.
Laura, this microphone is not COVID positive. All right, I had note cards that I forgot in my office, so Allison's going to pass out slips of paper for you to write either the name of Jerry or Frank or Reba or Nathan, all excellent choices. When you're finished writing who you're voting for, just fold the piece of paper in half or fold it twice and we'll collect them, and then we will tally the votes. And while Allison helps with that, tallying the votes, I'll go over a few notes about our next meeting.
Am I allowed to vote?
Of course you are.
Okay, thanks.
I'm not. I know. Is there a little box to put them in? Maybe not. Collection.
And we have have Jerry, Frank, Reba, Nathan. Oh, he's going to have me count the votes? He's got a box. I don't want to count the votes. I mean, I will if you want me to, but.
I can count while you talk about our next meeting then.
Yeah, okay, that's good. Someone who didn't vote.
Pardon me? Count them? You can, if Allison wants some help, sure. I could just tell you guys from talking to some of the DHS executives during the lunch break, they were debating among themselves, arguing among themselves, who's going to get the chance to come to our next meeting and present about this topic or that topic. But let me remind you, it's your council. So whoever presents is going to be requested by you guys. They don't get to decide. You guys, if you have an issue you want addressed, you tell me and Allison, and we'll find the person in DHS to invite to the meeting to talk about it. Now, if I don't get any ideas, or if there is something that they really have to talk to you about because it's coming up on the calendar, or it's a big change and you need to know about it, then we will go with their suggestion. But we want to hear from you guys on what you want to learn about, because that's what we're all going to be doing. Learning in order to make suggestions and proposals to make DHS services better. That's the point of our learning, to improve DHS services. So any questions before we announce our co-chairperson and tell you guys a little bit about May's meeting?
Just a quick question here.
Yeah.
Correct me if I'm wrong, but you said that the co-chairperson for next year will be selected from the 15 incoming council.
Exactly, because we want a co-chairperson who will have some experience when all you guys roll off the council after 2023. So yes, that's exactly right. Yes. Drum roll. Or, do you know? Okay, we'll let your chairperson announce her co-chairperson.
Some fierce competition. You all have selected Jerry to be the co-chair for 2022. Congratulations, Jerry. I look forward to working with you.
Thank you for all of you who stepped up and put yourself out there. I thought you all were very eloquent in your comments as to what you would bring and why you wanted to do it. So we're going to finish a little early. So because the weather's rainy, those of you who drove a long distance, thank you. You'll get a little head start on your way home. Let me look at my notes. The next meeting, again, Tuesday, May 17th. So put that on your calendar. If you have any issues getting reimbursed for travel or for your stipend, let me know, or let the folks with AFMC know, and we can get that worked out for you. This is the first meeting. This is their first opportunity to do that. So give them a little grace, but hopefully, like they said, within 10 business days or shortly thereafter, you'll be reimbursed for your travel, or you'll receive your stipend for attending the meeting. Next meeting, we want to get some, yes?
A meeting invite now that we have.
Yes, we will send out official meeting invites with, and the agenda will be attached as well. Remember your report to look over. This comes from a community organization, a kind of a grassroots type organization that you'll see where they get their statistics and their information, but they want to bring things to DHS's attention, but they don't have the platform that you guys have. They don't have the ears that you guys have. So that's why we're putting it in your hands to let you review it. And then, I think the suggestions any recommendation out of that report from this council will carry a lot more weight with DHS leadership. So if you see things in there that catch your interest, you want to learn more about, let us know. And we'll talk about it at the next meeting. So we'll have some feedback on the online application. Some of you, it was even brought up earlier that, you can do an online application, but not everyone has internet connectivity. You can translate the forms into other languages, but that doesn't always make it easy for the person to apply. So we're going to do a little discussion on that. We'll have someone with the Division of County Operations lead that discussion. They're over all the county offices in the state. Yes.
Any opportunity or need for us to review that website in advance, or are they going to do a show and tell here of everything we need to do?
It's always good to educate yourself on the topics to be discussed, but I anticipate that just like Sarah did today, you'll get a little debrief on what we're talking about if you don't have a chance to do that.
Send out that URL and take a look.
Take a look at it. And, what you like, what you don't like.
Sometimes I need time to think about things.
Mm-hmm. We'll also discuss the Arkansas Community Organization Report that we shared earlier in the meeting that you have. So take a look at that before May 17th. Any final questions before we wrap up, Frank?
For the online Medicaid, is it the online Medicaid? Is it the online Medicaid application or what application is it?
You know, there's a lot of different things you can do online. They didn't specify. They just said online application. So it could be for Medicaid. It could be for whatever is offered online. Yeah.
And how would we test the online application without putting our real information on there?
Yeah, it's more of a look at the form, and we don't want you filing test applications. Just go and look. Was it easy to access? Does it make sense? Are they asking questions that you think are irrelevant? Are they not including questions that you think are relevant? Just things like that. All right. Well, I appreciate each and every one of you. You all, based on your applications, rose to the top. You all have something to offer to this council, and we appreciate you being here. And I look forward to communicating with you in between now and our next meeting via email, and gathering again on May 17th. We are adjourned.